So now let's talk about the risks that are associated with ionizing radiation exposure. In this section, we are going to define and show the difference between biological, stochastic, and deterministic effects. In 2006, the National Research Council's Committee to Assess Health Risks from Exposure to Low Levels of Ionizing Radiation studied the effects of low-dose exposures on human health. The committee concluded that the current scientific evidence is consistent with the hypothesis that there is a linear, no-threshold dose-response relationship between exposure to ionizing radiation and the development of cancer in humans. In other words, it is most likely that there is no safe exposure level to ionizing radiation, and even low doses can potentially cause small increases in cancer risk later in life. Or, even more simply, all radiation exposure carries some risk. While patients undergoing image-guided procedures are exposed to higher doses of ionizing radiation than operating staff during the procedure, OR staff working in hybrid ORs are repeatedly exposed to low levels of ionizing radiation during each procedure they perform or assist in over the course of their careers. Though the doses are low, radiation protection for OR staff is still a concern. Doses received by OR personnel vary greatly, with the distance from the surgical table and the patient being a key factor in the dose received, placing surgeons and assisting personnel at higher risk than those positioned farther away from the table and the patient. Additionally, the behaviors of OR staff have been found to contribute to the total dose received. For example, one technologist may position themselves near the injector during a scan, while another moves as far away as possible. These differences in behavior affect their respective received doses substantially. As the technologist, it is your role to ensure the adequate and appropriate protection of both staff and patient. Shielding apparel is essential. We'll discuss some protective procedures and equipment in detail in a later section. For now, let's just focus on the risks and the effects of ionizing radiation exposure. In its Reactor Concepts Manual, Biological Effects of Radiation, the NRC provides a simple yet effective explanation of how radiation exposure affects the body. Radiation causes ionization of atoms, which may affect molecules, which may affect cells, which may affect tissues, which may affect organs, which may affect the whole body. In other words, when high energy particles or waves, radiation, hits living cells, they can ionize molecules, causing damage to cells that disrupt the normal cell processes. Put another way, and a simpler way, the biological effects of radiation exposure start with damage to the atoms that make up living cells and progress to larger structures from there. Biological effects from radiation exposure are characterized as either stochastic effects or deterministic effects. Stochastic effects are chance occurrences, and the probability of them occurring increases as the dose increases. Deterministic effects, on the other hand, do not occur unless the received dose crosses a specific threshold. Deterministic effects are all referred to now as tissue reactions. So we'll describe each type of these effects in more detail in the next few slides. So let's start with stochastic effects. Stochastic effects show up many years after exposure. These effects originate from radiation damage to DNA strands in single cells. The cells repair the damage, but incorrectly, so the cell is able to divide, but its daughter cells are abnormal. Cancer risk is the primary stochastic effect of concern. A patient's risk depends on more than just the radiation dose they receive. However, it also depends on their age, their sex, and the type of cells that were irradiated, among other factors. Remember, stochastic effects are chance occurrences and probability-based. Specifically, they're based on the probability that any single incident of radiation exposure will cause cellular damage that triggers the development of cancer or increases cancer risk. Now, let's look at deterministic effects or tissue reactions. Deterministic effects occurs when there is a threshold dose, and we will talk about that in a minute, and that threshold dose is exceeded. Below the threshold dose, there is no effect. Beyond the threshold dose, the effect occurs and worsens as the dose continues to increase beyond that threshold. Sunburn may be used as a decent analogy. No sunburn occurs until one is in the sun for a longer length of time. Where stochastic effects originate with damage to a single cell that leaves them mutated but able to divide, deterministic effects come from damage to cellular DNA and is so severe that the cell is unable to repair itself and either dies or cannot divide into daughter cells. Some examples of deterministic effects are cataracts, hair loss, skin injuries, and sterility. To summarize the biological effects of radiation exposure, this diagram shows a brief comparison between To summarize the biological effects of radiation exposure, this diagram shows a brief comparison between stochastic effects and deterministic effects. Deterministic effects are immediate, always occurring above a dose threshold. They have a reference dose attributed, and their seriousness is proportional to the absorbed dose, while stochastic effects are late, random in nature, and devoid of a threshold, again meaning the linear no-threshold hypothesis, or the fact that all radiation carries some risk. They reveal the concept of genetic instability and individual susceptibility, and their seriousness is independent of the absorbed dose. Any damaged cell can encounter 3 different repair scenarios. In the luckiest case, it faithfully repairs itself and no effects are generated on the body. Here we see a successful repair with no effects. If the cell is unable to repair itself, it suffers immediate or deferred death. This is when we speak about a deterministic effect on the body. If the cell repairs itself in an unfaithful way, we speak about stochastic effects that are divided into cancers and hereditary risks, depending on the nature of the damaged cell, being a somatic cell or a genetic cell. So here we see a damaged cell that is an immediate or delayed death, where repair may be impossible. Those cause deterministic effects, which are immediate. Here we see a damaged cell that misrepairs itself and occurs in one of 2 things. It can be somatic, causing a stochastic effect such as cancer, or it can be genetic or on the germ cells, causing a stochastic effect that is hereditary. These are considered late effects.